Hi, this is Dr. Chris Link from the Integrative Medicine Clinic. I'm glad you could join us. We're going to talk about mental wellness. Things like depression, anxiety, other emotional distress can significantly impact the quality of life of individuals and their overall health. It's also known that interventions like improving the diet, improving the sleep, intensifying the exercise, using appropriate nutrients, and even some botanicals can significantly impact the health and wellness of the individual and improve the mental health and resilience. Over the next 30 minutes or so, we'll dive deeply into this interesting area of research to explore some of the most effective ways to improve mental health and wellness and overall health and resilience. I'm glad you joined us.
So an overview would be we're going to look at nutrition and exercise and relaxation and sleep, and then some environmental and physical modalities that I found really interesting these days in regards to improving health. And then nutraceuticals, meaning really vitamins and minerals and why those make a difference. And then botanicals and herbs and how those make a difference. And I'll bet you that many of the people that you see have reached out to use some of those things. They go into the health food store, they're feeling down, and they think, well, I heard St. John's wort could be helpful for this. And they take it. Maybe it would be good for them. Maybe it might be problematic. It's kind of nice to know some of those things about that. I certainly see patients coming in on that. And these clearly are the challenges. You know, the genetics set us up. Doesn't necessarily pull the trigger, right? But it sets us up. And then there's adverse childhood events and stress, so many different things, personal, local, national, and then, world events like what's happening now in Ukraine that really affect us, make us uneasy, make us sleep less well, and then finances and poverty. Many of these people that have mental health issues, it's not just depression, it's a complicated life that's making the depression worse, a lot harder to get out of that, right? Relationships and loneliness and poor decisions and abuse, and then physical health and physical and medical conditions, pain. And stress and depression and mood makes pain worse too, right? Substance abuse. My story. So I trained in emergency medicine. I could take care of anything that rolled in the door. It could be somebody with a deep laceration and hemorrhaging. It could be somebody with a dislocated kneecap or a pussy willow bud of a 3-year-old's nose that I had to figure out how to get out. Somebody with a stroke or a heart attack or an appendicitis or multiple trauma. But I wasn't that very good at taking care of me, right? So in the mid-1990s, I had chronic pain and stress, and I wasn't sleeping very well. And I was working night shifts and circadian disruption, and I really wasn't well. And so I picked up a book, and that book was called Spontaneous Healing. It changed my life, and you can kind of hear it in my voice. Dr. Weil's book, and it showed me that there's there's a whole array of things about keeping people healthy that don't necessarily fit in the standard paradigm of allopathic medicine that I was taught. Right? There's so much more. And I reached out, I read that book. Eventually, I did some training in acupuncture. I did the 2-year fellowship like Dr. Sue did as well, with Dr. Weil out in Arizona. And eventually, I actually did some fellowship training in functional medicine, which is more of a high-tech understanding of hormones and nutrition and the biochemistry of human health. Then, with Terry, we opened Integrative Medicine Clinic, and that's our staff. So the keys to good health: eat real food, move, sleep, relax, connect in nature. And you'll see in some of the physical modality things we're going to talk about, nature makes a big impact. And then there's the power of prevention. There's been studies like this, but one in particular in 2009 showed that if you eat vegetables on a daily basis, if you move daily, you don't need to run a marathon, if you maintain a healthy weight, and that means less than obese, not thin, but less than a body mass index of 30, and you don't smoke, that you reduce the risk of those conditions by astounding amounts. 93% reduction in diabetes, 81% in heart attacks, 50% in strokes, and 36% in cancer. And I would say that means there's immense power in prevention, immense power. In fact, there's nothing I have to offer people in my clinic that's better than that. Not my antihypertensives, not my medications for diabetes, not my medications for gout. None of those things impact like those four things there. We're going to move into the nutrition. I tell people just to keep it simple, eat real food. More healthy whole food, less processed foods. And let me give you an example of that. And then lastly, read labels, and I'll give you an example of that in a minute too. You want to eat less of this. But look at this, 60% of the American diet is made up of these ultra-processed foods now. And it's worse for young people. 60% of the American. Those foods are full of problematic ingredients. They're high carb, they're high salt, they have highly inflammatory oils. These hydrogenated oils that come from soy and from corn and so forth that make our joints and our bones and our brain not so healthy. And they're hyper palatable. They're like way too easy to overeat. And they lead to things like obesity and diabetes and autoimmune disease and inflammation, right? And inflammation, I'm sure you all know this, but it's clearly a part in mental health. No question that, if our brain's on fire, we're not going to do very well. And then eat more of this. More veggies, more fruits and berries and beans and lentils and meats and poultry and fermented foods. And I'm going to underline whole fat dairy. 2 major recent studies showed that whole fat dairy lowers cardiovascular disease. Whole fat dairy, you would eat that. Low fat dairy increases diabetes. So whole fat dairy, and I can show you the reports on that. But
what's a whole fat dairy?
So cream or yogurt that's made from whole milk versus low-fat milk, and kefir that's made from the whole. So in a study, I'll just tell you very quickly, in Scandinavia, where they eat the most dairy in the world, they can now measure, a lot of times the way we do dietary studies is we do a food frequency questionnaire, and they're bad because people fib and they don't remember, right? So what they do now, like for fish oils, is you can measure the amount of omega-3 in the blood. And we know you're taking your fish oil, or we know you're eating fish. Now we can also measure dairy fat in the blood. And in this large Scandinavian study, the people that had the most dairy fat in their blood had the lowest cardiovascular disease. Huge study. So the Journal of the American College of Cardiology in August of 2020 put a paper out that now we do not recommend a low-fat diet and lower cardiovascular disease. We do not recommend it. In the major journal of cardiology in this country in August of 20. This is a kind of a cool study. This was in Circulation, a major journal in March of 2021. And it said, yes, veggies and fruits. So veggies are better than fruits. Fruits are fine, not too much if you're diabetic. And the key there is that you don't need to eat 7, 9, 12 servings. 5 servings was enough. When people got the 5 servings of veggies and fruits daily, their health there was no more increased benefit from eating more. It doesn't mean that you couldn't eat more. Some people do, but you don't have to. So a simple message, if we can get our folks eating more vegetables and fruit and just say 5, and then recognize that potatoes and fruit juices don't count. So when they go to McDonald's and have their potatoes with their ketchup, that's not 2 servings of veggies. So this is another big thing that's changed in my practice and my understanding in the last year, and this is about fermented foods. Great study out of Stanford where they took a group of people and they fed them fermented foods, 3 to 4 servings a day. 4 ounces was a serving, so a couple of big parts of sauerkraut's a serving of fermented foods. 4 ounces of kefir, whole fat kefir or yogurt would be, and what they found is significant decrease in inflammation. Things like CRP, TNF alpha, lots of things that we know we can measure in inflammation. And they said it's virtually miracle grow for a healthy microbiome. So, and you can see because you've got the sauerkraut plus the fiber, plus all of these wonderful bacteria. And as we get older, our microbiome is less and less and less diverse. And and lots of different reasons, the way we eat, the fact that we're not playing around with kids in the dirt, and like we may have otherwise had more diverse microbiome, it makes a difference in inflammation. Read labels. So you can You go to the center of the grocery store, you can pick up lots of different things. You can pick up a marinara sauce that's a Newman's Own. It's going to have tomatoes and basil and olive oil, or you can pick up a ragu, and it's going to have, well, ragu. And so not so good, right? And so Yoplait, you can see it has things like cornstarch and sugar, red 40 and blue number 1. I don't think we need to eat that. But this Stonyfield Organic has milk, pectin, and vitamin D. And then at home, you put your blueberries in it and a little bit of honey. And now you've got, keep it simple, eat whole food, right? Great for you. I've got big thing of plain kefir in my, and I almost have a little bit daily. It's delicious. It's the new ice cream. Okay. And then the worst thing you can do is drink liquid calories. So if you were going to have, say, a fancy coffee in the morning, and then you had, say, a Coke at lunch and some sweet drink in the afternoon to keep you going, and you cut the grass and you got to have some sweet tea, and then gosh, the game's on, you got to have a beer, and 1,400 calories. And most of us adults should be 2,000 calories each a day for food calories. It might be different for a young person that's really busy, but that's way too much. And they're empty calories that drive diabetes, high blood pressure, dementia, cancer, and these things called ages. Now, most of us know what hemoglobin A1C is, right? That is a hemoglobin molecule that's glycated with sugar. And the higher that level is in your blood, the worse your blood sugars are and your diabetes is. But it so happens that that same glycation process happens in all of our proteins, in our eyes, in our muscles, in our brain, from too much sugar. And it caramelizes the proteins in our body. So that's what sugars do. And that's why liquid sugars are such a problem. So these are things to drink: water, green tea, coffee, lots of water. And these days, things like these, these bubbly waters right at 20 calories. They're quite delicious and refreshing, but not a lot of calories. On my website is a essay that I wrote, Keep Nutrition Simple. It's available to anybody that wants to go there. And it goes through things to eat, things to don't eat. It talks a little bit about fermented foods, talks a little bit about time-restricted eating. But it's about a page and a half. It's not real long. It's not a lengthy thing. And it's really written for interested, informed adults. So you don't have to be medical for it. So we talked about nutrition and keeping us healthy. We know movement's important. And for anybody, if we can just get our steps, and not everybody's got the knees or the back, they can go out and get 7,000 steps, 4,000 for sure, but if you can head towards 7,000, we're healthier. And then if we can add a little resistance training, I'll show you a little study why that's important in just a minute. A little bit of cardio is great. It turns out that some intense cardio every 7 to 10 days is enough if you're doing resistance training and you're doing walking. You can do more than that if you like. And what these things do is they improve health and mood, and they improve something called BDNF, which is the brain-derived neurotrophic factor, which is this little, our body, when it's stressed, it often responds in ways. And one of the ways it responds is BDNF. And BDNF actually goes through the brain and makes the hippocampus regenerate some neurons. It's one of the few places in the brain that can regenerate neurons, and it increases memory. Exercise, and this is actually going to be published in July of this year. Psychology and Sport of Exercise. Moderate intensity exercise is effective management for key depressive symptoms like anhedonia, depressed mood states in adults with major depressive disorder. And they also went on to say that if you get somebody to exercise and they got something stressful to do, it's a good idea to do it right after that, because they're kind of more resilient and more, they just have more capacity to handle something more challenging emotionally. So I thought that was interesting. And this is the article about training and how strength training lowers all-cause mortality. So that's what the statistic in medicine that says dying from any reason before the age of 75 is all-cause mortality. And so there's a 10 to 17% decrease if you do resistance training, and it's over and above walking, hiking, exercising, okay? So resistance training is part of it, and you can do it lots of different ways. But the cool thing is it was only 60 minutes. 30 to 60 minutes weekly, you have a significant benefit. That's doable. I mean, that means 1 or 2 sessions weekly. Okay, now this was just hot off the press here, you guys. A revolutionary treatment. I want to know if anybody knows what this is, because you may have been reading about this. And if you might be interested in it, because if you don't know about it, I'll tell you about it. So revolutionary treatment that makes you live longer. It helps memory and creativity. It makes you look more attractive, keeps you slim, lowers cravings. It protects from cancer and dementia, it wards off colds and flus, it lowers the risk of heart attack, stroke, and diabetes. It improves moods, lessens depression and anxiety. Anybody know what it is? So sleep. And many of you might know Matthew Walker, who's a professor of chronobiology at the University of California at Berkeley. He wrote this book, a really neat guy. So this is powerful. Sleep is powerful. So we want to get more because we help us remember and refresh and repair. Clearly, we're going to teach people to avoid alcohol. We need to tell them to really be careful about caffeine, certainly late in the day. We need to think about sleep apnea. If they sleep 7 or 8 hours, then they're unrefreshed. And it's really common. It certainly does worsen mental health issues. And then I love these days trackers like the Oura Ring and the Apple Watch and other things. And even apps now, there's a wonderful app you can put on your phone that you can put by your bed, and it monitors it. It turns on the recorder if you start snoring, and you can see how many times and how long you've been snoring through the night. So it can be helpful. And then we need to relax. Stress leads to insomnia, muscular tension, poor immune system. Breathing is really a key, and we can learn lots of things. The box breathing or the 4-7-8 breath that Dr. Weil likes so much. But the real key is you want to breathe slow in and slower out, slow in and slower out, and then repeat. There's great meditation apps like Calm and Headspace, prayer and social connection, and gentle exercises like Qigong or Tai Chi and things like that can be wonderful. I do Tai Chi many days. And then Yoga Nidra, you're probably aware of this. This is kind of meditation for dummies, and it's really good. I'll show you more about Yoga Nidra. These are great books. I don't know if you know Emily Fletcher's book on Stress Less, Accomplish More. This has helped many people I've worked with. And this book by James Nestor is fabulous on breathing. Just very interesting. All sorts of the history of breathing, the change in our faces over the last 300 years because we breathe differently. Yeah, very interesting stuff. Holotropic breathing, which I'm sure you know about, Colin, and how that can be kind of a augmentation, something that augments psychological support. But Yoga Nidra is a guided meditation. It's free online. You can just go to YouTube and put in Yoga Nidra. You get plenty of them. These practitioners, Lizzie Hill and Kamini Desai and Ali Boothroyd and Liam Gilliam are great. So if you put in Yoga Nidra, you put in their names. They're 5, 10, 15, 20, 30 minutes. Yoga Nidra is so effective that at Stanford, they call it, they do studies on it, and they call it non-sleep deep rest. Non-sleep deep rest. And in studies like for students in learning, if they take 2 groups of students, one they do Yoga Nidra, they give them something to learn and to remember. They have the one group do Yoga Nidra, and then they retest. The group who did Yoga Nidra solidified their memories better. I love it. And the neat part about it is that you listen, you try not to fall asleep, but you don't try to listen so intently, like it's something you got to do. You just listen, so it's easy. And that's what I mean, it's kind of meditation for people who say, I can't meditate. My mind goes all over the place. So I love Yoga Nidra. And this one right here, this 15-minute one on this here, is Ali Boothroyd, and she has some singing bowls behind it as the kind of the ambiance music, and it's really, really good. Now we're going to move into some of the physical modalities. And this was an interesting paper in the Frontiers in Psychiatry, a terrific journal, that talked about fire, water, earth, and air, and how humans are influenced by their environment in nature. Well, we know that, but now we're learning about it a lot more. And they talked about heat and sauna and sunlight, and cryotherapy and green and nature. Forest bathing comes to mind there, and breathing. James Nestor's book comes to mind there. So this is in the journal, International Journal of Hyperthremia. And here what they do is they take people with depression and they expose them to heat, and they get their core body temperature up 101, 102, and they may do it a few times over 3 to 6 weeks. They have a significant benefit in mental health. Their M.D scores, their depression, changes things. It's a stress to the physiological system with benefits that the body responds with. Kind of interesting, these dynorphins and endorphins. So one of the ways it works is, and many of you recognize this. I know Terry, my wife, is this way. You put her in a hot environment, she gets a little bit irritable.
I will.
You will, okay. And so that's a dynorphin response. Dynorphin, endorphins make us feel better. Dynorphins make us feel poorly, agitated. I got to get out of here. I don't feel right. And the interesting thing, when dynorphins go up and then come down, so you expose yourself, you tolerate it, it makes you more responsive to the endorphins. So you're a little bit happier, you have a little less pain, you have a better response and better mood. That's one of the ways that this works. Now, the human body and physiology is so complex. This is only one. I'm sure there's many other things going on, but it's really kind of cool. So what they said is whole body hyperthermia is a promising complementary therapy for the treatment of depression with low risk for adverse effects. Now, this is not going to be done in somebody's home, not body core temperature 102, but certainly can be done in clinical settings. Now, what's interesting here is that in the last couple of years, there was a paper in the Mayo Clinic Proceedings, a major journal, and in the New England Journal about sauna and its benefit. And that can be done at home. And it does all sorts of things. And here's some of the things they said it did. It lowered their triglycerides and their cholesterol. It lowered their blood pressure. It improved their cardiorespiratory function. It's basically exercise on your backside. Because it revs up the cardiac stroke output, right? Because you're warm, you're vasodilated, your heart's pumping, maybe very fast. And it's safe because you can titrate it up. You can even take somebody with congestive heart failure and put them in a sauna. Not for 20 minutes the first time, but over time they get better and better and better at it. And I recommend this in my folks with cardiovascular, and it lowers inflammation. It lowers inflammation. One of the and brain health and inflammation. The other thing is, and I'm going to just give you an example. There's a protein, there's a couple of very interesting proteins that go up in your body when you sauna. One of them is called heat shock protein. So your body makes more of the heat shock protein, and it's meant to protect proteins. So when you cook an egg, it's got this, it starts out with this white liquid, and then you make it hot, and those proteins denature. And now it's a white of an egg, right? Turns out that our body's having denatured proteins all the time. And with heat stress, heat shock protein goes up, and these heat shock proteins go around unfolding these denatured proteins and putting back in the right orientation. There's also another gene that goes up. It's called FOXO1. And people who live to more than 100 have high levels of FOXO1 gene. This improves that FOXO protein, right? And what FOXO does is it protects our DNA from DNA damage and hits. So, summing all that up, when they studied this in Scandinavia, where they sauna many people several days a week, people who sauna 2 to 3 days a week have a 27% decrease in all-cause mortality, dying from any reason before the age of 75, 3 days a week. People who do it 4 days or more a week, it's a 50% decrease in all-cause mortality. And good journals, Mayo Clinic, New England Journal. So saunas can be great for health, but it's also good for brain health over here, some of the things. So love these modalities. Okay, so we like heat. What about cold? Cold exposure. This is in the Journal of Complementary Therapies. Whole body cryotherapy. Well, a lot of athletes knew this worked for years, right? But now there's major studies in the journal Nature and others that tell us about how it helps. It improves metabolism, can help. It actually changes some of our fat from a white fat to a brown fat, which is higher metabolic capacity. And it lowers inflammation. Meta-analysis of 10 studies was this, and the results indicate preliminary evidence that whole body cryotherapy is efficacious as an add-on for mental health. And so there was at least 2 patients I had this winter who had significant depression that I had them go to the cryotherapy unit in Columbia daily. and they lived in Colombia, they did better. Now, did they do better just because of that, or were there other things involved? I don't think it hurt them at all. And there's some reason to think that it was a nice intervention. It's a stress to the system. The system responds in a way that can be positive for the whole. So another is light. And this Samarhatar, now you may not have known this, and neither did I, that there's a section of light and circadian rhythms at the National Institute of Mental Health. Well, he is the director of that. So he's obviously I'm surprised that there is such an institute, but there is. And he's the director of it. He said that ultraviolet light, bright light that we might get from the sun, exposed to our eyes and our skin, improves our mood. That UV light from 10 p.m. to 4 a.m. lowers the neuromodulator dopamine and increases the risk of depression. So light during the day is good, light at night is bad. And let me show you this next study. So this was just published in March 2022, so just a few weeks ago, in the Proceedings of the National Academies of Science. Light exposure during sleep impairs cardiometabolic function. Light at night, even dim light, impaired sleep, increased heart rate, decreased heart rate variability. So that's the way we measure deep relaxation, heart rate variability. You should have very variable heart rates at night if you're deeply relaxed. And an increased insulin resistance, light at night. Didn't take much, just took a little. So when you go back to your bedrooms, or when you educate folks on how they can get healthier, you want their rooms want to be dark. It's possible. Even if they got to put towels over the windows, and if they can't afford, some room darkening shades, and you want to get little pieces of black tape and all the little green lights that are on all of those devices, right?
I'm going to tell you, they actually make stickers. They're called light dims. They're about $15 that are black or white or silver. You can buy a big pack. And they're made in all different sizes. They're meant specifically to cover those lights.
So Julie mentioned that there's light dim things that are available, stickers that are available on, say, Amazon or something.
They're called light dims specifically.
Light dim. Terrific. That's a great idea.
So UVB is pretty much any light. That's UVB.
Bright light, yeah. You get UVB. And it's in what they said in regards to the benefit, it wasn't just the eyes, it's the skin. Yeah.
They look like an iPad. They put off that light. I have a couple of those in
Yeah.
office, and you can just illuminate, put them at your desk, let that kind of coming off the side, and it has, it's proven to help with depression and things like that.
Yeah, absolutely, that's right. So,
that's what
right, the sad lamps are really important. Yeah.
Those happen with you.
So more on light, I thought this was interesting, but it just kind of tells you the importance of it. So solar exposure enhances romantic passion in both sexes. The UV light affects this protein P53. P53 changes circulating hormones in the body, and that increases testosterone in both men and women, and it increases this romantic capacities, and it also enhances females' receptiveness to males. So, this is obviously important biologically through all sorts of animals, in mammals, right? But it also tells us not so much about, creating increased passion in our patients, but it's better health, right? More vigor, more, if you got enough enthusiasm and vigor and energy for romantic passion, you're probably feeling better about other things too. Okay, now we're going to move on to the botanicals. And let me say here that I'm a big believer in 3 basic supplements for everybody. And though it was said by some of my colleagues along the way in some journals that these things just make expensive urine, that's really not the case, and there's great data these days to say that that's kind of an antiquated look at vitamins. So this one right here is a Cosmos Mind study, and it was done through the National Institutes of Health in Wake Forest, and they took 2,200 adults, 65 and older. Half of them got a multivitamin, half of them didn't, and they followed them for 3 years. The people using the multivitamin had a significant decrease in decline. We all decline a little bit in our mental function as we get older after a certain point. And the slope of decline was 60% less, or 1.8 years less in 3 years by taking multivitamin. This is a very important study done at a very good institution, the National Institutes of Health, good numbers of patients. And then this study was, I actually found this morning. It is going to be published May 1st on 2022. This was a study of micronutrients in attention deficit hyperactive disorder in children. It was 3 sites, so that's always makes it a better study. It was 8 weeks, it was placebo-controlled, 6 to 12-year-old kids, and they had to have at least one other symptom, some other irritability symptom. And their global benefit over placebo was significant. Micronutrients showed global benefit over placebo in a blinded clinician-related rating in this population of ADHD kids. And interestingly, they were tall. They got a little bit taller compared to the other group. So really, what are these micronutrients? So magnesium and multivitamins and calcium, chromium, and all of these things that they're going to put in a multivitamin, they're basically cofactors for enzymes. They're cofactors for processes in our body. Zinc, for example, is involved in 3,000 different processes in our body. Magnesium, about 500. If the child's not getting sufficient or optimal amounts of that, they're not going to perform as well as they could. How do you choose a supplement? I think the key there is this GMP, good manufacturing practices. This is a rigorous certification that manufacturers have to go through. All of their raw material needs to be tested that it is indeed it is what they said it is indeed what they thought it is. That is, if they're doing echinacea, that it is echinacea and there's no adulterants. Then they have to make it. Then they have to have it retested that there's no adulterants in it. Then they also have to follow it and make sure that if there's any side effects that they have to report it. So it's significant, and you'll find this on good products, GMP. We were talking about magnesium. Here I just want to say that magnesium is commonly deficient for lots of reasons. Our soil, the foods we choose, we eat too many ultra-processed foods without enough magnesium. And it's really important for the muscles, the GI tract, the brain. 3 different magnesiums I just want to point out. The least expensive one is magnesium citrate. It is okay. It's least expensive. It tends to cause a little bit of looseness in the bowels. Now, some people, that's a great thing. If they're slow and they tend to be constipated, magnesium citrate's great for that. Magnesium glycinate's kind of mid-range in regards, doesn't cause as much of the GI stuff. And magnesium always has to have a chelate. So a citrate is a chelate, glycinate is a chelate, the threonate is a chelate, so it's a salt. It has to have 2 components. And the glycine here is really interesting in that the glycine is naturally relaxing for the brain. I love this one for the night, for sleep. Glycine actually has been shown in animals to increase longevity by about 10%, glycine alone. So it's very interesting. And then magnesium threonate has been shown to improve cognition in people with cognitive impairment. But it's expensive. So not everybody can afford to use that. So that's a little bit of a overview on magnesium there. Now, there is evidence now linking, as we've talked about, depression with inflammation, and we can measure that in many markers now, things like hsCRP and tumor necrosis factor alpha and interleukins. And in this journal article in March of 2022, they said that these are often elevated in people with major depressive disorder. There's a wonderful herb that can help you with that. So turmeric is an Asian spice that has a component in it called curcumin. 1% of turmeric is curcumin. Curcumin is very anti-inflammatory. And 500 milligrams twice a day has been shown to improve treatment-resistant depression. And it's best with food because curcumin gets absorbed better with fat. And a lot of times, the golden milk, anybody know what golden milk is? So it's turmeric with milk. It's part of a dish. It's an Indian Asian dish. And it's one of the ways they use the turmeric. Omega-3. So to answer your question a little bit more, particularly the one that's good for inflammation is the EPA omega-3. It lowers inflammation. And about 1 gram to 2 grams daily, 1 gram would be sufficient of full EPA. A lot of times when it says fish oil, it has a little bit of EPA, a little bit of DHA, and then it's got some other kind of oil in there, and it makes 1 gram. But the real active component is the EPA, so you have to be careful if that's what you're going to use, that you know that it's got 1 gram of the EPA in it. Now, what's interesting, and the reason I put this chart up here, tryptophan is the amino acid that our body makes through cofactors and enzymes and turns into 5-hydroxytryptamine, which is serotonin. And serotonin is kind of a bliss hormone, right? It makes us more satisfied. Helps with mood. When inflammation is up in the body, when these things like interleukin-6 and TNF-alpha is up, it actually makes tryptophan go this way to this thing called kynurenine. And this is actually neuroagitating. And omega-3s lower these. So you get more of this. You get more of the serotonin. You get more of that neuromodulator around. Now for heart health, it turns out that EPA, every gram you take lowers your risk of heart-related disease by 9%. So we give people 4 grams of EPA, and we can lower heart attack risk significantly. St. John's wort, it works. There's few sexual side effects. It's as good as Paxil. The problem is that it reacts with every darn drug out there, and I never use it because of that. I mean, there may be an occasional young man that's not on birth control pills that doesn't want to take an antidepressant and doesn't want to have sexual side effects. I might use St. John's wort. And you can use 900 to 1800 milligrams once a day. Generally don't use it because of that. And that's why I don't want people going into the health food store when they're taking, blood pressure medications and maybe blood thinners, and not a good idea. So it works great, but now this is one I use a lot, and it's rhodiola. It grows in the Arctic. It has a lot of stress, and so one of the chemicals it produces under stress is rhodiola. Helps with stress and endurance, has been used for centuries. It's interesting that, here's an article in the Nordic Journal of Psychiatry that it lowered M.D scores, lessened insomnia, improved self-esteem. I thought that was kind of cool. The dose, you start at 500 milligrams, you can go up to 1,000. It generally works quickly. It should be given with food because it can cause nausea. There's not a lot of interactions with it. But there's a couple of things we need to know about. Is that if somebody's on an SSRI, there's been a couple of case studies that it should cause the tachycardia. So we don't use it with that typically. And if somebody has some propensity to mania, we don't use it there either. SAMe is part of our metabolism. It turns on methylation, so it helps us make neurotransmitters better. It works really well in doses between 800 and 3,200 milligrams. The problem with SAMe is it's kind of expensive. Not everybody can afford it. But it helps with pain, it helps with energy, it helps with mood. And here was a study where it was compared to Lexapro, citalopram, and SAMe worked better. And it worked quicker. So SAMe I use. Now the thing that you can take with this is that there's no serotonin syndrome concern, and it can be given with some of these other drugs to kind of help them work better. You can easily add a little bit with it. Don't give in those that have a tendency for bipolar because it's really activating. It turns on dopamine, it turns on norepinephrine, it turns on the catecholamines and other monoamines. 5-HTP is a precursor to serotonin. I'll just say here that it really works pretty good. It's underutilized, and you can use doses up to 1,000 milligrams. You want to give long acting, and you can give it all in the morning. So time release is the way to do that. It can be given in the morning. And I think about this when I'm trying to get people off an SSRI. If they're ready to come off, it's spring, for example, and things are going well, stresses are low, maybe they're having some side effects, I often augment with that. This was a study here at the top where they used 400 milligrams versus Prozac, and it was about equal. And this is another study where they use it along with a vitamin called creatine. And creatine and 5-HTP was very effective at lowering M.D, which is I think all of you know that's a score of depression. Lavender. Anybody ever use this other than in their... Lavender is really, really, really good in regards to being an anxiolytic. Clinical studies say that it's about as good as low-dose lorazepam, that 160 milligrams given in the morning. They're little capsules. And it really is it's an extract of lavender. And it's a safer thing you could put in a vaporizer and smell it. Most of those essential oils you don't take orally, but these in capsules you can. It's safe. Some people have a lavender burp. That's one of the big issues. And women with breast cancer, we don't use it because it has some estrogenic effects. But I like lavender. We use it a lot. And then saffron's kind of the new kid on the block. It's a beautiful herb that is activating. You start with 30 milligrams. It works like an atypical antidepressant kind of in the effexor. It's activating that way, turns up norepinephrine. It can be combined with 5-HTP, can be combined nicely with rhodiola. And there was one study in children that 30 milligrams was effective with ADHD. It helps with focus. And in this study, April 2020, overall results showed that saffron possessed better efficacy in the improvement of depressive symptoms when compared to placebo. And I don't know that that's a great testimonial, but it's, then you have to. What's that?
Metabolic function. And it helps
Oh,
with
right.
weight.
Julie mentioned that it's also kind of good for weight loss. Anxiety. This is a real favorite of ours for anxiety. It's an extract from green tea called theanine. And it's not a caffeine, it's theanine, and it helps with a chattering mind. Doses are 1 to 2 daily, and it can be used with SSRIs or SNRIs for resistant depression. We're getting to the end, there's just a couple more. Ashwagandha is also a favorite. Look at the things it does. It lowers cortisol, lowers norepinephrine, lowers the intensity of perceived stress, can improve testosterone. No serious interactions with medications. You've got to use a good dose and a good quality product.
And increased testosterone. That's interesting.
And it supports, yeah, and I didn't put that out there, also supports thyroid, as you know. So, yeah. Kava is from South Pacific, and it's great for tension and muscular pain. It acts a little bit on dopamine. Years ago, it's got kind of a bad name that they had some adulterated products that called liver disease, cause of liver disease. That's not the case the way it's formulated now. It can increase depression a little bit, so we use it in more anxious people and people with muscular tension, so we don't use it so much in just depression. And I like it for PRN use of tension to the neck, tension to the back. I mean, just really nice. You can get a tincture or you can get capsules. You know, the way they use it in the South Pacific is they have community gatherings, and they have kava root, and they're together, these, I guess, community members, and they chew it. They chew it and they spit it in a bowl, and that's how they do it, and it gets pretty concentrated, and everybody gets pretty relaxed with it. So PEA is kind of a new kid on the block. This is palmitoyl ethanolamide, and it improves treatment-resistant depression. You can add it to SNRIs and SSRIs. It works through the endocannabinoid system. And I'll tell you, there's other things that work through the endocannabinoid system, and one of them is chocolate. And it's okay for people to add foods that support the endocannabinoid system. And there's other ones, but chocolate is one of those. It attenuates pain, pelvic pain, men and women, and the dose is about 1,200 milligrams a day. It's getting some traction for abdominal pain and other things too. I don't have a great deal of experience with it, but it's something that we're starting to use. You know, I learn about these things at conferences or other clinicians that I know and respect. If they've got, got safety and advocacy, I'd like to then use it in my practice. It isn't working, and then I really know. I really know who to use it for. And the last one here is creatine. Now, creatine is known by all of the 18-year-old weightlifters and wrestlers in town because it makes their muscles bigger and stronger. And we used to think it was a bad thing, that it's got to, if it's doing that, it's got to do something. It's hurting their liver, is it hurting their kidneys, is it this or that? None of that. And in fact, the way creatine works is it recycles ATP. ATP is the energy currency in every cell of our body, from our brain to our heart to our nerves. And it can be used, so if people have kind of a apathetic, low-level depression, you add some creatine to it, you give them a little bit more energy. I use this in people with fatigue. I use it in people with cognitive issues, clearly mild cognitive impairment. I use it a lot, and it's really safe. Very interesting. It works in this phosphocreatine pathway that's in the forebrain in one particular area, and that's the same place ketamine works. And what ketamine is good to do in this area of the forebrain is it helps us learn, change plasticity, but it also helps people unlearn. Right? So the traumas that they have, it helps them unlearn these. And that's part of how ketamine works. And it's part of how creatine works, because through that pathway. So it's safe. 5 grams, it's a white powder, best to take. 5 grams is hard to take because that'd be 10 capsules. Most people take it with a scoop, put it in water, it's virtually tasteless. Great for low energy, not to be used. You know, these things that are really energizing, you don't use in people with bipolar. And this is the last slide. Questions? Thanks for hanging in there. I didn't see too many eyes closing or.
I still don't understand